AP 120, Chapter 13, Topics, Blood Pressure. So blood pressure is the force of the blood against the inner walls of blood vessels. And we usually are referring to arterial blood pressure when we talk about blood pressure because the arteries experience the highest blood pressure. As we can see here, the blood pressure within the arteries varies based on whether the heart is relaxed or contracting and how far the blood has traveled along the various vessels. So, for instance, when the heart is having the ventricles contract, so ventricular systole, the blood pressure is at its highest, and that will, of course, go down as you travel through the arteries, into the capillaries, and into the veins. And then the blood pressure when the heart is relaxed during diastole is less, and it also decreases as it goes through the arteries, capillaries, and into the veins. So we talk about the blood pressure being two numbers, the higher number being the systolic blood pressure, the pressure when the ventricles are contracting, the lower number being the diastolic pressure, the pressure when the ventricles are relaxed. And so this is the highest and lowest. The blood pressure is found in the arteries relatively close to the heart, so the larger arteries. Now we can measure blood pressure, arterial blood pressure, using a physmomanometer. Okay, people just call it a blood pressure cuff, but that's the official name. And if we were in person, then you would actually get to play with these, get to try to use them. The normal range for blood pressure for a systolic number is between 100 and 120, and then for the diastolic number is 60 to 80. So somewhere between 100 to 120 over 60 to 80. Now, if either number is chronically higher, then the person has blood pressure that is high or hypertension. And if either or both numbers are chronically low, then the person has low blood pressure, which is probably called hypotension. So again, this has to be chronic, constant, because obviously our blood pressures do change depending on the amount of activity and excitement we are experiencing. So the pulse is the ability to actually feel the surge of blood through the arteries when the ventricles contract. And there are different points along the body where it's possible to feel the pulse. The radial arteries at the wrist, the carotid arteries in the throat, femoral arteries in the upper arm, and so on. So things that affect the arterial blood pressure. Well, we have the cardiac output, which is a combination of heart rate and stroke volume. We have, of course, blood volume that can increase blood pressure, blood viscosity, how thick it is, and peripheral resistance caused by the blood flowing against the inner lining of the arteries. So cardiac output, blood volume, blood viscosity, and peripheral resistance. Now, cardiac output equals the stroke volume, how much blood is moved per beat, times the heart rate, how fast the heart is beating. So the standard stroke volume is about 70 milliliters. So about 70 milliliters, or a shot glass worth of fluid, is sent out each time the ventricles contract. And the heart rate, on average, for the average person is 72 beats per minute. So 70 milliliters times 72 beats per minute equal about 5 liters of blood moving through your heart, through your body every minute. Turns out that is what our average blood volume is. So every minute, all of our blood is being moved throughout our body. So blood volume can affect blood pressure. The higher, the more blood volume there is, the higher the blood pressure. So higher blood volume equals higher blood pressure. lower blood volume equals lower blood pressure. And again, the average for an adult is 5 liters. And that's what these water bottles represent here is 5 liters of fluid. All right, peripheral resistance is the friction between the blood and the walls of the blood vessels. This resistance will slow down or hinder blood flow. And when arteries are constricted, vasoconstriction, this decreases the lumen, the space within the arteries, which then increases peripheral resistance. So more cells are contacting the walls. This is increasing the peripheral resistance. As you can see, you put your thumb or finger over the opening to a water thingy. I can't remember what it's called now. And the water comes out much, much faster. And then vasodilation is decreased peripheral resistance because the arteries are increasing the size of their lumen. They're getting wider because the muscle tissue has relaxed. And so less cells are contacting the wall, and this will decrease blood pressure. So remove your thumb from the opening to the hose, and the blood, or water in this case, will come out slower. All right, blood viscosity is how thick the blood itself is. And the thicker the blood, the slower it is or more difficult for the blood to flow through vessels. So we want our blood to be thinner rather than thicker. So greater viscosity equals greater blood pressure, lower viscosity equals lower blood pressure. Aspirin, the reason why they tell people who've had heart attacks to regularly take aspirin is because it actually thins the blood. It decreases the blood viscosity, which would then decrease overall blood pressure. All right, so blood pressure equals cardiac output times peripheral resistance. This is what we usually interpret as meaning blood pressure. And so the body is able to easily control cardiac output by speeding up or slowing down the heart, and relatively easily able to control peripheral resistance by constricting or dilating arteries. And so these are quickly able to affect blood pressure. Blood volume and blood viscosity, on the other hand, take a lot longer to adjust. So controlling blood pressure. Well, the blood enters the heart and the walls are stretched. The more the walls are stretched, the stronger the contraction. This makes sense. If walls are more stretched, that means there's more blood within the heart, so it's going to want to constrict, to beat harder, to push all the blood out. Things that can cause this is, of course, exercise. Exercise increases venous blood flow, so increases the amount of blood flowing through the veins and entering the atria, stretches the atria and ventricles, leading to a stronger contraction. So contraction strength equals amount of blood in the ventricles. Strong contraction means strong increase in stroke volume, which of course increases cardiac output. So stroke volume increase equals cardiac output increase, which then of course means an increase in blood pressure. So how active you are can affect your blood pressure. If you take your blood pressure when you're exercising and or working out in some way, you'll notice your blood pressure is higher. But it's okay because it's for a short period of time. There are also baroreceptors found within the larger arteries that are measuring blood pressure. And if they experience an increase in blood pressure, then that information travels to the cardiac center of the medulla oblongata. And if this pressure is not supposed to be high, then the cardiac center will send out signals to the heart to slow down the heart rate. That is, of course, the parasympathetic division of the autonomic nervous system. So again, we have baroreceptors detecting blood pressure in the major arteries. If they detect higher than desired blood pressure, that information goes to the cardiac center in the medulla oblongata, and then commands are sent out to slow the heart rate, decreasing the blood pressure. And of course, you can have the opposite. If blood pressure is too low, then that information again goes to the medulla oblongata, And this time through the sympathetic division, signals are sent to increase the heart rate. Increase the heart rate, heart beats faster, that increases blood pressure. So cardiac output increases, this increases blood pressure. This will stimulate the baroreceptors, sending the information to the cardiac center in the medulla oblongata, and then a signal will be sent out to the sinoatrial node to inhibit or slow down the heart rate, thereby lowering the blood pressure. Peripheral resistance, again, has to do with whether the arteries are constricted or dilated. Vasodilation decreases peripheral resistance and therefore decreases blood pressure. Vasoconstriction will increase peripheral resistance and therefore increase blood pressure. And it turns out there are vasomotor centers in the medulla oblongata. So control centers in the medulla oblongata that control dilation in the arteries. So controls the dilation, vasodilation or vasoconstriction in the arteries to help affect blood pressure. There are also receptors detecting various chemicals that can then affect whether the blood vessels dilate or constrict. So if the arteries or arterioles in a certain area are detecting increased carbon dioxide levels or decreased oxygen levels or a decreased pH, this can lead to vasodilation, which would then decrease blood pressure. The arteries will widen from the dilation, decreasing blood pressure. If, on the other hand, the arteries are detecting the hormones epinephrine or norepinephrine, commonly known as adrenaline, this will lead to vasoconstriction, and that will cause the lumen to be, the space in the arteries to be smaller, and that would increase blood pressure. Decrease blood pressure so that blood is present in these areas to allow for exchange. Increase blood pressure because we are scared or angry and want blood to flow quickly to the different places it needs to go. Venous blood flow. Well, in the veins, the blood pressure is super low. So low, in fact, that it cannot overcome gravity. So makes you wonder, how does blood get from the legs back to the heart? Well, it turns out that the veins are positioned to take advantage of various factors, effects going on in the body. So there is veins located between around skeletal muscles, so that when the skeletal muscles contract, they will squish the veins, forcing blood toward the heart. We also, of course, have veins located properly within the thoracic cavity, so that as the lungs expand and pressure builds in the thoracic cavity, and to an extent in the abdominal cavity, this will squish the veins, causing blood to go toward the heart. And of course, blood only goes toward the heart because of those lovely valves located within the veins. And then finally, the third way blood can be moved along the veins is vasoconstriction. The veins can constrict, decrease the space within them to help push blood toward the heart. So skeletal muscle contractions, the movements of breathing, and vasoconstriction of veins are all ways that help move the blood in the veins back to the heart. And here is just, again, saying what I just said. Contraction of blood muscle squeezing, thoracic and abdominal pressure from breathing in squeezing, and constriction of veins squeezing. And that is it for this part of the lecture.